got some thoughts on that, and I'm going to, at this point, yield to Dr. Rowe for his comments.
I thank, excuse me, I thank the gentleman for yielding, and I appreciate the opportunity to be down here on the House floor today to discuss, Mr. Speaker, this extremely important issue of health care. And one of the reasons that it is important, and it is so important, is it affects every single American citizen in a personal way. When I first came here 5 years ago, and as Dr. Gingrich said, I spent 31 years practicing my trade and practicing medicine and teaching in medical school in Johnson City, Tennessee. And I know that the thing I saw as the biggest issue and problem in health care, and Dr. Gingrich did also, was the cost of care. I saw the cost going up, and I saw more and more people that didn't have access to affordable health insurance coverage. And I say this as a joke, but it is true. I have never seen a Republican or Democrat heart attack in my life. I've never seen a Republican or Democrat, never operated on a Republican or Democrat cancer in my life, and I've operated on many of them. These are people issues, and why in the world we passed a partisan health care bill makes no sense to me whatsoever, Mr. Speaker. I have never understood that, now going on 5 years later. We should have sat down in a bipartisan way and talked about, as Dr. Gingrich so eloquently explained, taking care of those 15 or 20 million people, whatever the number is. We could do that. Let me give you just some data in my own state. In 2011, we had 2.5% of our children in our state that didn't have health insurance coverage, and and we're not a wealthy state, and about 10% of the population, 1 in 10 Tennesseans, didn't have access to coverage. Not everybody had a Cadillac plan, but they had basic health coverage. We did this massive 2,700-page bill, which I've read. I almost hate to admit that I've read it all, but I have. And we did this with now tens of thousands of pages of rules that add absolutely no value for patients whatsoever. It doesn't pay for anybody's prescription. It doesn't pay for their operation or hospitalization or immunizations and so on. None of those things. So, Mr. Speaker, I see the need, and certainly the need for health care reform. I totally agree with that. And the premise that if we repeal the Affordable Care Act, that we go back to where we were. Not true at all. And what we did, Mr. Speaker, and again, let me say this, and I believe this to the core of what I did for 30-plus years, and I believe it today, is that health care decisions should be made between a patient, that patient's family, and their doctor. It shouldn't be made by an insurance company. It shouldn't be made by a clerk at the insurance company. It shouldn't be made by the federal government. And I think the rollout of the Affordable Care Act, and one of the problems with that is, and it was absolutely predictable what would happen, because when you listed the essential health benefits, Mr. Speaker, if you read the bill and you had ever run a business as I had, you know that you made some changes in your health insurance every year. We did this. If there was maybe a copay or the out-of-pocket or something changed in that bill, new procedure. If you read the bill, it said if those things changed in any significant way, you lost your grandfathered status. And let me, and I apologize if Dr. Gingrich's already done this, but I want to read the essential health benefits that are required for you to buy and purchase. 10 categories: ambulatory patient services, emergency services, hospitalization, maternity and newborn services. Let me just point out that one of my friends who's a sheriff, Sheriff Seals in Sevier County, Tennessee, came to me the other day when I was visiting there and said he had a friend who just lost her insurance because she's 55 years of age, has had a hysterectomy, and her insurance plan, which met all of her needs, does not include maternity coverage. So she lost her health insurance because, as almost 90,000 Tennesseans have done. Mental health and substance abuse disorder services, including behavioral health treatment, prescription drugs, rehabilitative and habilitative services, devices, laboratory services, preventive and wellness services, chronic disease management, pediatric services, including oral and dental and vision care. Those are things that you have to have in a plan or you lose your coverage. And remember now that this is only affecting about 18 or 20 million people. Next year, when the employer mandate kicks in, the employer reporting requirement kicks in, Many people on an ERISA or a job-related, where you get your health insurance through your job, through your work, if you don't hit these benchmarks, guess what? You're going to lose grandfathered status, and that's where these staggering numbers are 50 to 100 million people, because right now, Mr. Speaker, we provide about 160 million people in our country get insurance through their employment and their families. So that's what we're facing. Now, we mentioned what the Affordable Care Act promised it would do, and Dr. Gingrich's pointed this out very well. He's pointed out that it was promises that were made. Universal coverage. We were going to cover everybody. Didn't do that. No new taxes on the middle class. Well, boy, is that ever something that wasn't true. Annual savings of $2,500. We've heard the President say that on numerous occasions. That's not true. No increase in the deficit. We already know that this bill is going to cost some 2 or 3 times what it was purported to cost. And I think the most famous one we've all heard now enough times, if you like your doctor, you can keep it. If you like your health insurance plan, you can keep it. Not true. We were tasked on the Republican Study Committee, Health Committee, to come up with a market-centered approach to health care, which would include no new taxes, no mandates, maintain the doctor-patient relationship. And it's a very short bill of 180 pages. It has been reviewed back during the Bush administration to increase by 9 to 11 million people that would have health insurance, and we think far more than that. And there are 6 titles to this bill. Very simple to understand. One is to overturn the Affordable Care Act. That's number 1. Number 2 is to equalize the tax treatment between an individual and a company. Well, what does that mean? I'll use myself as an example. When I worked for my medical group, my health insurance was deductible. I then retired from that group to run for Congress, and when I then had to go buy health insurance, I had to pay first dollar. I couldn't deduct it. This simply says you get to deduct your health expenses if you're an individual out there, a farmer, a small business person, just exactly like a huge company like Dow Chemical can do. So it treats you the same as an individual. That's a mistake that was made 60 years ago in the tax law we correct. We massively expand health savings accounts. I use a health savings account. Well, what is that? Well, it's a way where you put pre-tax dollars away in your own account, and if you don't spend them on health care, you get to keep them. I use myself as an example again. We had a health savings account for 2 years that we started 7 years ago. I still have $6,000 in that account that I can use for preventive services, for buying prescription drugs, for lots of things that my insurance doesn't cover. And if it's above a $5,000 deductible, my insurance is 100% covers all the costs. And guess who would have had that $6,000 if I didn't have it? The insurance company would have had it as a profit. This allows you and your doctor to make those decisions. We expand those to veterans, to seniors. We also do medical liability reform. Dr. Gingrich has a wonderful bill that we do that for. We also allow you to buy across state lines. It's the only insurance you cannot purchase is health insurance across the state line. You can buy life, fire. I personally have never seen an insurance agent. I've always used the web and bought my insurance across state lines. You can do that, and you can form association health plans. Let's say large church groups want to get together. Instead of small churches where there's one pastor or 2, you can join with larger churches and groups across maybe an entire region of the country and get thousands of people. That helps take care of pre-existing conditions. We also have a high-risk pool for pre-existing conditions. And lastly, there's no funding for abortion services. So a very simple bill. It's patient-centered, market-oriented, and it will work. And Mr. Speaker, I'd now like to yield back to my friend, Dr. Gingrich.
Mr. Speaker, I thank the gentleman from Tennessee for being with us during this hour. And I want to hold up this card so our colleagues can see. This basically is the bill that Dr. Rowe, Representative Rowe from Tennessee, is the author of this bill, and I'm a proud co-sponsor. It's called the American Health Care Reform Act. The American Health Care Reform Act. And Dr. Rowe described many of the aspects of this 180, I think, page bill, not a 2,700-page bill, but a 180-page bill. And as he points out, first of all, first and foremost, and I said this a little earlier, Mr. Speaker, this bill, the American Health Care Reform Act, a Republican alternative, we do have alternatives, First and foremost, fully repeals the President's health care law, Obamacare. It ends billions in taxes. It eliminates thousands of pages of unworkable mandates and regulations that literally, and I'm not kidding you, are 8 feet high. I'm not barely 6 feet tall, so just imagine that. And forcing millions of Americans to lose access to their health plans and gets federal bureaucrats like IRS agents out of health care decisions. What do they know about doctor-patient relationships? They don't know a thing about that. And of course, as Dr. Rowe said, and there's just 7 bullet points on here, but they're good common sense market-driven reforms, like he talked about tax reform that allows families to deduct health care costs if they're a sole proprietor, somebody that is a craftsman that makes furniture in his or her basement, and maybe it's a husband and wife team. They don't get this break on their health insurance that Dr. Rowe said was kind of artificially created back in World War II, back in 1942 or 3, when wage and price controls were put in place, and companies, big companies, couldn't attract new workers because they couldn't pay them enough. They couldn't give them a decent raise, so they started providing free health care. But the individual didn't get that break. So that's just one of the 7, and I won't read all of them because we've been joined also by a great member of the House GOP Doctors Caucus, the gentlewoman from North Carolina. Her husband's a general surgeon. She's a surgical nurse before Congress. And as I say, a member of the House GOP Doctors Caucus. She knows of what she speaks. And I yield to Representative Renee Elmers.
Thank you so much for this opportunity to speak here with the Doctors Caucus on these very important issues. You know, you are bringing up a very important piece to this puzzle. As far as the American people are concerned with their health care, they want Washington bureaucrats out from the examining room between them and their doctor. You know, patients want to be able to have that relationship with their doctor. And you know what, I'm sorry. If anything has played out over this very short period of time since October 1st with the failure of the website rollout, we've seen that Washington has absolutely no business in health care. And this is only going to continue to play out. And I just want to take a few moments and speak on some of the issues that continue to remain in these failures of the website. And I know that the administration, I think we've spent over $630 million now with 50 contractors fixing this website that we've been promised for so long was going to be ready, online, on time, working great for the American people. And we know that that's simply not the case. Once again, the tip of the iceberg when it comes to the failures that we will learn about into the future on health care. You know, I'm here today to talk about how this is affecting American families and those who are reaching out to me in my district, the 2nd District of North Carolina. You know, Obamacare is turning family budgets upside down and inflicting unnecessary pain on millions of Americans. Millions of Americans now have learned that their health care policies have been canceled, and it clearly states, due to the Affordable Care Act. Nationwide, women in this country make the health care decisions. Over 80% of the health care decisions that are made by women. That means that wives, mothers, are single women choosing health care coverage for themselves have now been told by the President and the Democrats that voted for this bill and knew full well that you wouldn't be able to keep your health care plan if you liked it. Now they're being told, you know what you chose for you, your family, what was affordable to you is not adequate, and we know better than you do for your family. I think that is an incredible problem and has been overlooked by this administration and our Democrat friends. You know, how many times do we hear that Republicans don't understand women's issues. How many times do we hear about the war on women that is continued to be displayed by our friends across the aisle? This is truly the war on women. Taking away health care coverage from millions of women in this country is truly the war on women. That's why we, as Republicans, have been working so hard to do everything we can to stop this process of Obamacare moving forward. Yes, we have voted over and over again to repeal it, and for good reason. And we're seeing how it's being played out now. For these very reasons. This is not patient-centered reforms. This is not about good patient care. This is not only going to completely and totally disastrously affect the health care coverage in this country, but also health care itself, because as you know, one plays into the other. I'm worried about what's going to happen to our physicians over time. We know that that part of the website hasn't even been built yet. When physicians aren't even sure what they're going to be paid, when patients aren't even sure what coverage they will be able to receive and what treatments they'll be able to receive, which doctors they'll be able to go to. Think about the women in this country, the moms who are going to find out over the next couple of months that the pediatricians that they have come to know and trust, they are no longer able to bring their children to. Think about our parents, the seniors who are receiving treatment right now at different hospital systems, in different health care systems, that are going to find out they can no longer receive their treatment there because the networks have been narrowed so incredibly. This is what's going to play out over the next couple of months. You know, on the front page of today's Washington Post, it reads, healthcare.govs make frequent enrollment errors. Right there. You know, after, again, all the millions of dollars that have been spent, and we still have errors. This isn't what we've come to know in America. You know, we know that 3-year-old children can get online and get on their iPads and go to town and understand computer systems and whatnot. And we can't even build a website that will allow patients in this country, families in this country, to navigate to get basic health care coverage. That's a problem. But there again, that's why the federal government should not be in health care. That's why government bureaucrats should not be standing in between patients and their doctors. This comes only days after the Obama administration claimed victory for fixing the disaster-prone website and rebranding the error messages that continue to pop up as a queuing system. Since day one, Obamacare has been a complete disaster and is only getting worse. As the Washington Post points out, those who have enrolled through the online marketplace may soon discover that their application contains errors. These errors have been generated by the computer system, which means even they were one of the few to successfully enroll, they could still find themselves without coverage over the next few months. There again, think about what's going to happen January 1st. When there are patients that think they have health care coverage and they're going to go to the doctor only to find out that they're not even within the system. Those failures include the notification of insurers about new customers, duplicate enrollments and cancellations, and it's incorrect information about family members and mistakes involving federal subsidies. I thank my dear colleague for, again, allowing us to speak out on these issues, because it cannot be stated enough how important it is that we be pointing out the inefficiencies that are created with Obamacare, the Affordable Care Act, which we all know now is completely and totally unaffordable. Thank you.
Mr. Speaker, I thank the gentlelady from North Carolina, and now it's my pleasure to yield time to the gentleman from Indiana, Representative and Dr. Larry Bouchon, cardiothoracic surgeon, and also a member of the House GOP Doctors Caucus, and I yield time to Dr. Bouchon.
Well, thank you, Dr. Gingrey, and thanks again for having this time for the Doctors Caucus to talk about health care reform. And what I want to focus on in my brief time is the Republican alternatives that we've had all along. When the Affordable Care Act was brought to the floor, there was only one amendment allowed, and that was a motion to recommit amendment. And guess what? The Republicans had an alternative health care plan, which we put forth. Since that time, we've had multiple plans, almost 200 other proposals from Republicans to reform the health care system in a patient-centered way. And as a physician, that's what we want. We want this to be focused around the patient, not around Washington bureaucrats, not around decisions made here in Washington. But we want patients to have access to quality, affordable care, and we want everyone to have that, just like the Democrats say that they do, even though with their plan, the Affordable Care Act in 2023, the CBO says 31 million people will still be uninsured, which is a fact that not a lot of people are looking at in the media at this point. But we've had all kinds of alternatives. Dr. Tom Price has had a bill that he's put up many times, H.R. 2300 in this Congress. The Republican Study Committee in this Congress, led by Dr. Rowe, has a very good health care reform proposal. And again, along with almost 200 other proposals to reform health care. So I want to dispel this myth that Republicans don't have alternatives to a near government takeover of the health care system. As Congressman Elmers just stated, that's the plan here. The plan is to have the government nearly control the system, and we can't have the government in health care because it doesn't work. And we're finding that out now with what's happening with the Affordable Care Act. Access is actually going to be inhibited by the Affordable Care Act. In some states, 80–90% of the people signing up for the Affordable Care Act are in the Medicaid program, a program already underfunded, a program already that's poor insurance that limits the very access to health care that we're all fighting for. The exchanges, which are going to be overly costly. Look at the deductibles you're seeing in some plans across the country. Look at the price you're seeing on the monthly payments across the country. Again, over 5 million people had health care that they liked, but they've lost it. We may see 50 million people or so next year when the delayed employer mandate comes into place that was unilaterally delayed by the administration, I would argue against the will of Congress because it was in the law and is in the law. So I want to just focus on the fact that Republicans have alternatives. The GOP Doctors Caucus has been involved in all of these. And I don't recall, but you probably can tell me, where you consulted in 2009, the doctors in Congress, when the health care law was passed. And from what everybody tells me, no. The answer to that question is no. If you were going to talk to anyone about what might be good health care reform, wouldn't you think you would actually consult with people that have been in the field practicing medicine for years? The doctors, the nurses, the other health care providers in Congress that could give you that firsthand experience that they've had in the health care system as part of the equation if you're going to do this right. So again, Republicans are for patient-centered health care reform. We realize that people were uninsured. We realize that the cost is too high. We want to bend the cost curve, get people insured by getting the cost of health care down and making sure that all of our patients have access to quality, affordable health care in a timely manner without Washington, D.C. government bureaucrats telling them what is a good policy, what's a bad policy, and I will argue in the future telling them what's good health care and what isn't. With that, Dr. Gingrey, I yield back.
Mr. Speaker, I thank Dr. Bouchon, the gentleman from Indiana, for those remarks. I want to read a little bit from one chapter in Sally Pipe's book, The Top 10 Myths of American Health Care. And this, the title of this chapter, Mr. Speaker, and real quickly, Solutions, Markets, Consumer Choice, and Innovation. And really, that's what Dr. Rowe's bill is all about, the American Health Care Reform Act. And listen to this. Listen to what Sally Pipe says. None of the preceding chapters is meant to suggest that America's health care system is perfect. It's not. Costs are high, and too many Americans get left behind. Reform is needed. But true reform of the health care system requires less government interference, not more. Only with a freer market can we lower costs and achieve quality universal health care. If we have universal choice in health care, we will reach universal coverage. And that's a goal that's supported by all of us, Republicans and Democrats. Now, consider this. Colleagues, Mr. Speaker, I know you're familiar with LASIK corrective eye surgery. Because most insurance providers, including government programs, won't cover the procedure. The market isn't distorted by excessive regulations. Providers operate in a free market where technology is constantly advancing, price competition is fierce, and the consumer is the king. Companies rise and fall according to their ability to provide customer satisfaction. In the past decade, more than 3 million LASIK procedures have been performed. During that time, the average price of LASIK eye surgery has dropped nearly 40% from $2,200 per eye to $1,350 per eye. Unfortunately, LASIK is a rare exception to the general rule. In just about every other area of health care, the government is heavily involved. So the key to lowering cost and expanding coverage is to expand the LASIK model. And that means encouraging competition by decreasing government's role in the health care marketplace, not increasing it. And again, she goes on to mention many of these bullet points in Dr. Rowe's bill, the American Health Care Reform Act, a better way, indeed a better way. And at this point, we've just got a few minutes remaining. I want to yield back to Dr. Rowe.
Just a couple of points I'd like to make, Dr. Gingrey, is that, one, this bill is not perfect, and it is open for amendment as opposed to the Affordable Care Act that was not open for amendment. As I recall, you and I were both here then. That was my first term when we had that debate. Some 80 amendments were brought to the Rules Committee here, and zero, was ruled germane to the bill. As Dr. Bouchon was speaking, there were 9 of us physicians in the Doctors Caucus 5 years ago. Not one of us was consulted about the health care bill. Really rather astonishing, I thought. And to Congresswoman Elmers, she made a point a minute ago and wasn't as passionate about it as I am. I think one of the most arrogant things I have heard stated in this town was that what you have bought that you like is no good. I still find that amazing that somebody, a talking head, could be on television and say with a straight face, not knowing what I purchased that I'm perfectly happy with, that it's no good. That is beyond arrogance. And we've heard people over and over in this town say that very thing, and that's why people are turning against this. When you tell me what I've sat down with my family and worked out what I can buy, and it seems to work for me just fine, that it's no good, that I know what's better, because I've got it right here that you have to buy. That is the height of arrogance, and I just was a little more passionate about that.
Well, reclaiming my time and yielding it back to Representative Elmers, let's hear some more passion from the young woman from North Carolina.
And I thank you to my kind doctor colleagues on that issue. But you know, Dr. Rowe, you hit on one of the very important parts, again, which is if you've had something that worked for you, if a mom was buying health care coverage for her family, she was the one that did the research, she was the one that did the time, she picked the appropriate plan. You know, maybe it was offered through an employer, maybe it was an individual plan, but she sat down at her kitchen table and decided what was working for her. And guess what? Now the Obama administration says no. You know, and I agree. Some of the talking heads that are out there, you know, on the 24-hour news cycles, telling everyone that these plans were subpar, that they weren't adequate. And the constituents who are reaching out to me are saying, I liked my plan. You know, I was having my hair done the other day, and my hairstylist, Cindy, and her husband, Lee, they have a health care plan. She said, Renee, I don't understand this. I had a health care plan that Lee and I picked We have had this plan. We like our plan. It's affordable to us. It's providing the health care coverage that we need. And now I'm being told that it's not adequate, and the cost of my premiums every month are going to go up, and my deductible is going up. For what? Well, I will point out to you one of the issues. You know, one of the flaws that the Obama administration and our president himself has made over time is saying that as people learn about this thing, because if you remember when it was passed, and you were here, you both were here, they said, oh, well, let's just get it passed, and then we're all going to find out what's in it. You know, some of our esteemed colleagues across the aisle had made those comments. And you know what? Now, when the American people are finding out what's in it, they don't like it. Things are changing. They're finding out what's in it, and they don't like it, and they're rejecting it. One of the reasons that those costs have gone up are the essential health benefits that have to be covered. For every American, there are 10 essential health benefits. My friend Cindy, she and her husband do not have children, and yet they are forced to purchase maternity coverage. They are forced to purchase pediatric coverage. Now, these are wonderful things for families, young families, growing families, but they're not appropriate for every American. So what is lacking here in Obamacare is choice, the ability to choose your plan. I'm all for getting health care coverage for every American. I want every American to be able to have affordable health care coverage. But you can't do it by forcing individuals to buy something that they will never use, they will never need, paying a premium price and cost out of pocket. I'm sorry, it's just not affordable for American families.
Well, reclaim my time as we draw to a close. You know, I said earlier, 61% of the American people are opposed, even today, 3.5 years after passage of this law, and they can't even get on the website. They can't get signed up. Wait till they get signed up and find out what they're going to have to pay and the amount of deductible, and I guess I would call that sticker shock.
Well, the gentleman
I think instead of 61%, it'll be 80% opposed to it, and I yield back to the gentleman from Tennessee.
I just want to make one comment, Dr. Gingrey, that I tried today for the 6th time to get signed up, and I couldn't. So I'm going back Thursday for the 7th time. I yield back.
You'll reclaiming the time as we close. I tried to get on today. I couldn't. I got the error message. I didn't even get put in the queue to make it a little softer. But no, I got the error message and got kicked offline. And Monday is the last day. So I'm going back to my office after we complete this and try to get on once again. And so, I mean, I am really feeling for the patients, the seniors, the American people that are really in one heck of a mess because of this not well thought out, rushed bill that was totally partisan. You just can't do that in this Congress with a bill this important. We're talking about human lives here, life and death. And that's not the way to do it. But we will come back with a solution, and I hope we will do that in a bipartisan way. I love the American Health Care Reform Act. I am a co-sponsor. And with that, Mr. Speaker, we yield the balance of our time. Thank you.
The gentleman yields back. Can we just go ahead and go to... Under the Speaker's announced policy of January 3rd, 2013, the Chair recognizes the gentleman from Texas, Mr. Gomert, for 30 minutes.
Thank you, Mr. Speaker. Well, we got a notice, all House member briefing, it says Iran, Wednesday, December 4th, 9 a.m. The briefing team, right at the top of the list, Ambassador Wendy Sherman, Undersecretary of Political Affairs. And so that was thrilling. I recognize that name, Wendy Sherman. who's going to give the House a briefing in the morning at 9 a.m. on how good things have gone in the dealings with Iran. As the Wall Street Journal article from November 20th points out, the Clinton administration's policy coordinator for North America, Wendy Sherman, is now the Obama administration's lead negotiator for the Iran nuclear talks. In a 2001 New York Times op-ed, Ms. Sherman urged President Bush to cut a deal, writing that Kim Jong-il, quote, appears ready to make landmark commitments because to ensure the survival of his regime, he has to improve the country's disastrous economy by reducing the burden of a vast missile program and opening the doors to trade. Well, Ms. Sherman was wrong about that in her op-ed she wrote in 2001. Kim Jong-il needed to help his economy, right about that, but she thought it meant that he was ready to get rid of his ballistic missile program and open the doors more to trade. Well, certainly they were willing to open the doors to trade, but just as she had been wrong in 1994 when she helped the Clinton administration work out an amazing deal with North Korea. To recap the highlights of that deal with North Korea, Korea was believed to be pursuing nuclear weapons, so Ms. Sherman was the policy coordinator for North Korea, involved in this process. She, Madeleine Albright, President Clinton thought, what a great thing. We will give you nuclear reactors, nuclear power plants, give you some fuel, and in return, you have to renounce nuclear weapons, and you have to promise not to pursue nuclear weapons. Wow. Oh, there was one other thing. The Clinton administration, Wendy Sherman, Madeleine Albright, agreed to provision that would have prevented them, and did prevent them, from inspecting the North Korean nuclear facilities for at least 5 or so years, which ended up being enough time for them to pursue their nuclear weapons. I mean, for President Clinton, Madeleine Albright, Wendy Sherman kind of remind me of the repossession guy that Jeff Foxworthy talked about, coming to his house when he was poor, telling him he hadn't made his payments in months, and so he had to take his car, and Foxworthy begging him not to take the car, that he's got to have it if he's going to get back on his feet, make a living. And the guy says, I have to leave either with the car or with cash or a check, to which Foxworthy says, he replied, you'll take a check? Well, why didn't you say you'll take a check? Sure, I can write you a check. Well, that's what the North Koreans did. Oh, you mean in return for new sophisticated nuclear power plants and fuel, you'll take just a promise from us that we won't pursue nuclear weapons? Well, why didn't you say that? Sure, we'll promise anything you want in return for nuclear weapon fuel and nuclear power plants that we can use for our own benefit. Sure, we'll make those promises. Any other promises you want? I mean, how gullible does an administration have to be to believe that a promise from a rogue regime is worth basing the future safety of your citizens upon? Well, we don't have an answer to how gullible you have to be, because this administration is now doing the same thing. Wasn't enough that Wendy Sherman was wrong in 1994, that she was wrong in 2001 in her op-ed. Now, she is the lead negotiator with Iran, and she's going to brief members of the House here tomorrow. How gullible are we? I mean, there's no requirement that we have to be as gullible as this administration. I mean, sure, maybe you believe in administration when they say, if you like your insurance, you can keep it. Maybe you believe that administration when they say, if you like your doctor, you can keep your doctor, period. Maybe the House is gullible enough, or maybe the majority at one time was gullible enough to believe that and did. In fact, people in this room actually repeated those promises, making them themselves. But how many times do you have to be shown that people making the promises are wrong before you get skeptical? And now, on top of all the broken promises about Obamacare, we have an administration promises us that we can trust Iran, that we've made a great deal. They've made us some promises just like North Korea did, and we know we can trust them because the only thing at stake is the existence of the nation of Israel and the existence of the United States without nuclear weapons going off in it. That's all that's at stake. Or perhaps an EMP caused by a nuclear weapon that's shot off from a intercontinental ballistic missile. Doesn't even have to be that accurate. If it goes off near the middle of the United States, a certain range of elevation, then it will fry most every computer chip, and we're going to be in trouble. Grocery stores can't operate appropriately without their computer systems. Walmart, there are all kinds of places that won't be able to operate appropriately. Most everybody's car is now relying on computer chips. Our military is very reliant on computer chips. And yet this administration says now Iran is somebody we can trust. And I keep coming back to what some allied leaders said back in September in the Middle East. Do you guys not realize that you're now helping the people that attacked you, the organizations that attacked you on 9/11, make up the Taliban, Muslim Brotherhood background, Al-Qaeda, Muslim Brotherhood background? I mean, what do you not realize that allows you to now help the people you're at war with, or supposed to be at war with? And I say the word war, and then, of course, this administration's made clear we're not at war with anybody. According to this administration, we are trying to counter violent extremism, but we don't talk about terrorism. We don't talk about radical Islam. We've stripped that from our training manuals because it may offend and does offend radical Islamists that want to destroy us and kill us. So we don't want to do anything that might offend the people who want to kill us. You know, there was a time in this country when if another group declared war on us, then we fought them. We weren't going to let them win that war against us. And this administration thinks you can make a great deal with Iran just like the Clinton administration did with North Korea and stop their nuclear proliferation right in its tracks. And I would humbly submit, Mr. Speaker, it will be just as effective, less so than the deal with North Korea was. Iran has been crippled by sanctions, but sanctions were not going to stop Iran from developing nuclear weapons. They have consulted with, they have learned from North Korea how you game this system. All you have to do is enter talks with a Democratic administration like the Clinton administration or the Obama administration, and they'll cut you a deal. They'll even help you get nuclear material. All you have to do is write them a check, and on that check say, we promise not to pursue nuclear weapons. Heck, the United States under the Clinton administration, they've shown they'll even agree not to inspect your nuclear facilities, which will allow you to finish your nuclear weapons. Well, Israel understands what a tremendous mistake this is because they're too close. Their existence rides on not making a mistake of the calamitous nature that this will be, and this is. So it's amazing, though, you know, people stood up, made America all kinds of promises about Obamacare, and it turns out at the time promises were made about Obamacare, they had already had the discussion and knew that people wouldn't be able to keep their insurance if they wanted it. They knew they wouldn't be able to keep their doctor if they wanted it. And so what do? They said, well, we got a presidential election coming up, and it won't sound good to use words like, if you like your doctor, there's a chance you might can keep your doctor. That won't sell good in the election. If you like your insurance, there's a chance you might can keep your insurance. That won't sell, so we got to go out and tell what we know is not true so that we can win the next election. Oh, yeah, how about that Benghazi? Let's keep that under wraps. We know that it was an attack by an al-Qaeda-affiliated group. Of course, there may have been some concerns that they used the very weapons that this administration supplied to the al-Qaeda-infused rebels that may have been turned on our State Department personnel, our ambassador, and they didn't send anybody to help them. Did not send anybody to help them. We had planes, we had personnel that could have gotten to Benghazi and at least saved the last 2 of the 4, could have saved Dave Ubben's leg, could have saved a lot of damage, could have saved the classified material being out there for a month or so for anybody who wanted it to get it. Could have saved all of that. But no one was sent. People want to believe promises that are made by their own government, especially when it pertains to something as important as their own health care, or their own defense of their nation when it's at risk. Well, it is at risk. There are people who are at war with us. They've been at war with us since 1979. We didn't really fully appreciate it until 2001 on 9/11. And now we have an administration that has completely failed to realize that the people that declared war on us in 1979, who want Sharia law to govern the world, that want a worldwide caliphate over which the 12th Imam will rule the world, and some of them believe Jesus will come and fight at his side. This administration does not understand they've never given up on their goals. Thank God that most Muslims do not believe the radical Islamist approach to Islam. And I'm grateful. But it's crazy not to realize that there are radical Islamists that want to destroy our way of life. So we get word today, as the Obama administration has, or yesterday I guess this came out, as the Obama administration is bragging over their great deal with Iran, now Iran announces, this article from the Washington Free Beacon, a second nuclear reactor. And the leader, Rouhani, says, our enrichment will never stop. So much for this administration's misplaced belief in the Iran honesty. These people, these leaders are at war with us. They want to destroy us. They want to destroy Israel. How can we get someone in this administration to take notice? Mr. Speaker, I have the answer. It's when people in the United States Senate and enough people here in the House say, Mr. President, you can't do this kind of damage. We know it's innocent. We know you think this is the way to go, but we know you can't trust Iran. You can't trust the Ayatollah Khomeini. You could not trust the Ayatollah Khomeini. You could not trust Ahmadinejad. And just because they got a different president, they've still got the different leader. And by the way, we didn't used to call the Ayatollah Khomeini the supreme leader, just like U.S. leaders didn't used to call Hitler Mein Führer. He was not entitled to that title. He was an evil man. And I personally don't think it's appropriate for any United States leader to call someone who hates Israel and hates America and wants them wiped off the map and thinks that the 12th Imam is coming and will one day rule over the area in which Israel is, the area in which the United States is. We should not be calling that man supreme leader. Same thing as calling him Mein Führer. You don't do it. And this administration has not learned that lesson. So Iran, they announced that they're still not going to comply with what the Obama administration says they've agreed to do. And yet still this administration is sending the former Clinton policy, North Korean policy director, former Democrat who was advising President Bush in an op-ed to cut a deal with Kim Jong-il that he really wants to make a deal, kind of like North Korea did in '94. She was wrong in '94. She was wrong in 2001. She's wrong now about Iran. We're told that those who refuse to learn from history are destined to repeat it. And when there is enough arrogance that anyone, any leader thinks they are smarter, wiser, better than anyone that's gone before, therefore they can make a better deal with corrupt and evil people like no one else has made, then their name goes down in history just as Neville Chamberlain's has. He waived his peace agreement, which he agreed to give away part of Europe to his Fuhrer, thinking it meant peace in his time. And what it meant was his ignorance and naivety was going to cost millions of people their lives. History is there for people who are willing to study and learn from it. I shudder for the people in Israel. I shudder for people in the United States that think we're invulnerable. The only way the United States could possibly stay invulnerable for a while longer is if its leaders realized we are vulnerable and we have to stay prepared, we have to stay vigilant, we have to stay on the lookout for people that want to destroy our country. And yet, they'd rather make a deal with aligned cutthroats who lead Iran than they would to sit down and work out an agreement with Republicans in the House of Representatives. We were willing the night of the shutdown. We were willing the day before the shutdown. We compromised 3 different times, and Harry Reid refused to even allow negotiators to be appointed. We appointed ours. People say Republicans shut down the House, shut down the government. We didn't do that. Harry Reid did that. He refused to even negotiate. It was his way completely. And he asked a question. Press was there. Not many of them reported on how ridiculous the question was. But he asked the question basically, what right do they, the House of Representatives, have to say what government programs get funded and which do not? Well, I asked that exact question to 4 constitutional experts that testified before our Judiciary Committee today. One clearly was a defender of the Obama administration, yet all 4 of the witnesses, brilliant constitutional scholars, even though we have our disagreements, these are brilliant people, and every one of them had the same answer for Harry Reid's question. The answer is the United States Constitution, Article 1, Section 8. It gave Congress control of the purse strings, and it gave the House a little more control than the Senate. The Senate's got to go along with whatever legislation is going to become law. But he asked the question, I put it to our experts, suppose you were in a town hall meeting with constituents back in a congressional district, and an elementary school child asked the question, what right does the House of Representatives have to decide which government programs get funded and which do not? And they unhesitatingly said the answer is our Constitution, Article 1, Section 8. They all agreed. They all knew immediately. So I've asked that the chairman of the Judiciary Committee make that testimony available to our dear friend, Senate Majority Leader down the hall, so he won't have to ask that question to reporters who are not familiar with the answer. We can get it to him straight from some of the greatest constitutional minds on both sides of any aisle. And he'll understand it's the Constitution that gives us the right to have a say. And for Harry Reid to shut down the government by saying you're either going to give us every dime that we demand or the government will be shut down is really outrageous. They shut the government down. We even gave them an out. As the Chinese saying that, wise saying that it's good to give your adversary a graceful way to exit. We gave the Senate majority, Democrats, a graceful way to exit by saying, look, all right, you don't want to completely defund Obamacare. We get it. We think that's the best idea for America. Well, here's a compromise. Let's just suspend the whole bill for a year. Harry Reid could have taken that and said, oh, we don't want to do this, but the Republicans in the House are making us hold off on all of Obamacare for a year. Gosh, golly gee, we didn't want to, but they're making us. That was a graceful way they could have exited, but they were so determined to shut the government down that when we came back with another compromise passed out of this body, said, okay, well, how about if we do this? The President has unconstitutionally, and that became very clear today in our hearing, for the President to say he wasn't going to enforce the business mandate in Obamacare is unconstitutional. Not only is it unconstitutional, the President is directly violating his oath of office. He is required to faithfully defend the laws, see that the laws are carried out, and he announced he wasn't going to do it for a year. He doesn't have that kind of luxury. But even in a spirit of compromise, extreme compromise, I didn't vote for it. I thought we shouldn't be compromising against ourselves, but a majority in here voted to send the bill, and we sent it down to Harry Reid in the Senate that said, okay, the President has decided to suspend the business mandate for a year. If businesses deserve a mandate for a year, let's do it for every individual in the country for a year. That gave Harry Reid another out. He was so determined to shut down the government, he wouldn't even bring that to a vote. And then our final, ultimate compromise, in compromising against ourselves without any Senate offer of compromise whatsoever, was to say, okay, here's our negotiators. We are appointing. We voted for it. We sent the list of negotiators. You appoint yours. We'll probably have a deal by 8 a.m., and we'll not even have to have a real shutdown. But Harry Reid was determined to have a shutdown, so he got a shutdown. And now there is no graceful escape because we have got to repeal Obamacare. That is very clear, and I hope that we do that. And I see my friend from California. Actually, he's a very dear friend. We've been in some interesting situations worldwide as we stand up for our country and for the people of the United States of America, for truth, justice, and the American way. And my time is about to expire, but let me say before it does, I didn't vote for the patent bill in Judiciary Committee. I have some real concerns about it, as I did the last one that I voted against. I still believe in my heart we should not have changed 200 years of patent law from the first to invent being right, changing it to the first to file being right. I think the law was appropriate the way it was. We needed to make some reforms, but I think we made a glaring error. Many people came to this floor and said, we've got to pass that bill to deal with the issue of patent trolls. And now we have another bill that we're told will likely come to the floor tomorrow, that this time it will really deal with patent trolls. And there are some things in there that I like, and I'm glad we're trying to deal with them to help people that need to be helped. You know, where a bank is utilizing a procedure that they paid for, they're not infringing on anybody's patent intentionally. And so to hold up people, you know, a small community bank that don't have $1 million to spend on patent litigation when they're innocent stakeholders, it just seems grossly unfair. There are things we ought to do, but I'm very concerned that we ought to be spending more time. Let America help us get this bill right, and I'm still hoping that we will wait, get more input so that we don't mess up the patent system any more than we already have. My time's expired, I know, or is about to, so I yield back so that my friend from California may take time.
The gentleman's time has expired. Members are reminded to restrain from personal references towards the President.